Good morning, all. Today we will be talking about the fever following vaccination, a somewhat new topic for anybody. In fact, if you search on the literature, you will not find any major article or the presentation on this topic. So this is the new topic, and I thank Dr. Yagnesh Popat and his team for allowing me to share my views on this new topic. How do we define the post-vaccination fever? There is no agreed definition of post-vaccination fever, but the gold standard definition of fever is the rectal temperature of more than 38 degrees centigrade or above following vaccination. Adverse events following immunizations are categorized into two different categories, major or the minor. The major could be serious or the severe one. The passive surveillance system of AEFI in United States have found a fever to be the most frequently reported non-serious AEFI for all age groups, with the exception of persons aged between 18 to 64 years, in whom the wide variety of local reactions are more frequently reported. So, fever being one of the most common manifestation of minor AEFI. It is quite common to develop a fever after vaccination. This normally happens within 48 hours of vaccination and usually goes away within next 48 hours. This is an expected reaction. It is usually self-limiting without any specific complication. Then why we should worry about it, or why we should talk about it? Often fever are associated with illnesses, and therefore it is understandable that the parents are concerned that whether their child is suffering from fever is because of the post-vaccination or it is because of any other disease. So they would like to clarify. Second most important point is the febrile seizure. There are some children who are prone to have a febrile seizures, and the parents of such children are definitely worried and they do not want their child to have any episode of convulsion in lifetime. So whenever there is a fever, whether it is because of vaccination or because of an illness, they do not want it. So because of these two major reasons, they are worried about the post-vaccination fever. You will find less Indian studies on this topic, but there are a couple of studies from European countries who had looked at the various aspects of the post-vaccination fever, particularly the fever patterns, probability of fever after a particular vaccine, management of such fever, as well as the cost of having such post-vaccination fever. Majority of these studies have reported a fever frequency, but there are very few studies which has reported post-vaccination fever pattern. This is a busy slide with regards to the timing and frequency of fever after some of the common vaccines. Just look at this red marks. Fever can happen from 1 to 17 days after hepatitis B vaccine, 0 to 7 days after pneumococcal vaccine, and as long as 42 days after chickenpox vaccination. In cases of multiple vaccines where the multiple antigens are used, like MMR, DPT, and others, the fever can be as after 14 days. And in case of DPT vaccination, fever occurs more frequently after the second dose. Why fever occurs in a post-vaccination phase? The vaccine prepares the immune system to protect against viruses or bacteria that could have made the child sick. The way this happens is that they introduce components of germs that are known to activate the immune response. However, vaccine will not cause any significant enough immune response that a person suffers to any untoward events such as that occurs following the natural infections. And with this said, in some cases, the immune response is strong enough to cause a detectable symptoms like mild fever. So does it mean that the vaccine is not working if there is no fever? Definitely not. Not everyone who responds to a vaccine will develop a fever. Post-vaccination fever is common after Any vaccine, it can occur due to any vaccine, but the frequency of fever occurring within first 24 hours following vaccination is highest following DPT containing vaccines, and other vaccines that also cause fever in majority of the cases are pneumococcal vaccines and the measles containing vaccines. There are few important characteristics of post-vaccination fever. Fever usually starts within 24 hours, but it can occur as late as 42 days, usually mild, but can be high grade, especially after DPT containing vaccines. In interfebrile period, the child is comfortable, no other associated symptoms like cough, cold, diarrhea, headache, etc. And febrile period is usually short and self-limiting. Fever phobia. A post-vaccination fever phobia could lead to an unnecessary testing as well as treatment and emergency department visits. This increases both medical cost as well as the possibility of side effects. The post-vaccination fever has its own fever pattern, which is dependent on which is the vaccine which is used and use of antibiotic drugs. Hence, post-vaccination temperature monitoring may ease the fever phobia. Let us understand post-vaccination fever by a couple of cases. Case 1, 2.5-month-old girl from an urban slum presented in a monsoon season with a fever of 101 degree Fahrenheit since 1 day. There was history of vaccination with hexavalent vaccine before 1 day. What is your thought? Probably this is a post-vaccination period. Just observe the child. Next case. A 9-month-old child presented with fever of 2 days duration has undergone a vaccination with MMR before 3 days. Now, what is your thought? This is again fever starting after 24 hours of vaccination, could be because of measles vaccine, and so probably this is a post-vaccination fever. Case 3. A 5-year-old girl having a high-grade fever since 3 days, headache since 1 day, vomiting 3 to 4 days per day last night, feels weak, has undergone a vaccination for 5-year booster before the start of the fever. Now, what is your thought? यहाँ कुछ तो गड़बड़ है. क्या गड़बड़ है? There are high-grade fever. There is high-grade fever associated with headache, vomiting, and feeling of weakness. So this couple of points towards some issues that the child might be sick. So such a child should be investigated and not just labeled as post-vaccination fever. How do we manage post-vaccination fever? As usual in case of any other fever, make the child comfortable, avoid hot environment, avoid excessive clothing, give plenty of liquids, and if required, do a tepid sponging. If the fever is high grade and the child is uncomfortable, use paracetamol for the fever, but do not give medication prior to vaccine or as a prophylactic immediately after vaccination. What are the economic implications? Whether caused by an intercurrent infection or immunization, fever after childhood immunization has an important economic implications with 2-fold increase in utilization of medical services and 3-fold increase in work loss for at least one parent. And as per one of the US studies, the parents reported willingness to pay a median of about $50 to avoid a fever after immunization. So there are economic issues related with the post-vaccination fever. So to conclude, although there are many aspects of societal, medical, economic, and epidemiological meaning of fever as an AEFI are still elusive, but it is still a common, generally benign clinical sign. The cost of potentially unnecessary clinical and diagnostic evaluation of a child with fever after immunization to be clearly offset by a risk of complication from disease that would have resulted had we no vaccination programs. So friends, always keep on reminding the patients that short period of discomfort is a whole lot better than a visit to an ICU. Thank you.